If you had to give up a part of yourself for a better quality of life, would you do it? This is what it's like for women who have to decide on whether to get a hysterectomy. In most cases, it's necessary for uterine and cervical cancer, but for those who suffer from uterine fibroids, doctors offer a hysterectomy first before any other options. This is why I urge those who suffer from uterine fibroids to get a second opinion before considering a hysterectomy. Today, I'll be discussing the complications after operation and the lack of awareness of other treatments. Now you may be asking yourself, how does this apply to me? I don't have uterine fibroids. Some of you may be male. But what if someday you have to get surgery? Wouldn't it be wise to get a second opinion before deciding on a life-altering surgery? This includes considering the complications post-surgery. In the article, Spontaneous Transvaginal Small Bowel Evisceration After a Laparoscopic Hysterectomy, in 2022, there was a case of a 59-year-old female who went to the emergency room 6 months after a hysterectomy and had a ileum small intestine prolapse into her vaginal wall where her uterus used to be. Although this is rare at a 0.032 to 1.25 chance of risk happening, the high mortality rate is at 6 to 10% because of this complication. In a 2013 article, Complications of Hysterectomy, written in Obstetrics and Gynecology, other complications can occur like infection, blood clots, damage to the urinary, genital, gastrointestinal tract, and organs. When it comes to treatment, a lot of women who are less educated and have a low income are unaware of less invasive treatments for uterine fibroids. In a 2024 article, The Role of Socioeconomic Status in Uterine Fibroid Awareness and Treatment, a narrative review, Giovanna Evans and Kennedy Jones reviewed 10 articles and discovered that treatment options are limited according to race, most specifically African American women, and women who are less educated and have low economic status. They found in a 2022 study that African American women are 2 to 3 times more likely to get a hysterectomy than Caucasian American women, due to African American women having more severe symptoms of bloating, pelvic pain, and abnormal bleeding. Evans and Jones also found that in a 2005 study that women with a low gross income, less than $61,000, and have no private insurance are less likely to receive less invasive treatments for uterine fibroids, and women with higher education income are 12 to 18% more likely to receive alternative treatments. I know that getting a second opinion can be time-consuming to find a doctor. It would be better off sticking to your primary doctor, but hysterectomy should be treated as a last resort like cancer in special cases. There should be other options available like hormone treatment and non-invasive surgeries like uterine artery embolization, where they insert tiny catheters in the blood vessels using imaging to guide it down to the uterus and destroy the fibroid at the source. To sum it all up, hysterectomies have a risk of complications that shouldn't be recommended to treat uterine fibroids, and the lack of awareness for treatment options due to race, education, and income status makes it a problem for those seeking medical help. This is why I advise those who are seeking treatment for uterine fibroids to not settle for the easier option. Get that second opinion if your doctor is only recommending hysterectomy. It's better to be wise than regret it later. To answer the question, would you give a part of yourself for a better quality of life? My answer is it depends on if I have a choice to consider invasive and non-invasive surgeries or treatments. I hope you are given the opportunity and knowledge to decide for yourself which option would be best for you.